Great, thanks, Maytal. So I'm going to be sharing with you all another presentation about nursing perspectives in maternity care, but my presentation is going to focus on kind of pre-COVID experiences and kind of those nurses' experiences with the Baby Friendly Hospital Initiative before COVID kind of came onto the scene. So next slide, please. Awesome. So as you all know, much of the Baby Friendly Hospital Initiative work is led by nurses, and it's dependent on nurses' adaptation. But little is known about nurses' perspectives about BFHI in kind of the medical literature. So we wanted to share that 97% of Mississippi CHAMPS hospitals have baby-friendly task forces that are led by nurses. And then since 2014, 22 hospitals in Mississippi have been baby-friendly designated, and much can be learned from their experiences. Next slide. So CHAMPS decided to conduct focus groups of nursing staff in baby-friendly designated Mississippi CHAMPS hospitals. And the objective of these focus groups was to describe obstetric and postpartum nursing staff's experience becoming baby-friendly, including the perceived barriers and facilitators to designation. And so we analyzed those data using a thematic analysis approach. You can see in the figure below kind of the process of a thematic analysis. So there are 6 phases. The first is familiarizing yourself with the data. So really we read through all of the transcripts from the focus groups. Generating initial codes. So then it's when you're reading through those transcripts, kind of organizing them into different buckets or different codes. The next phase is searching for themes. So kind of organizing those codes into different themes, reviewing those themes, and then finally defining and naming the themes. And then summarizing the results is the final phase. And that's really when we wrote up this paper. Next slide. So the results from these focus groups were that we did 5 focus groups total, which included 22 nurses. And then 5 main themes were identified. They're listed here, and I'm going to go through each of these themes on the next few slides. So next slide, please. So in terms of the kind of hospital and nurse demographics from the hospitals where we did the focus groups and the nurses that we interviewed. So 3 of the hospitals were in rural areas of Mississippi. 2 of them were in metro areas. On average, the number of months that the hospitals had been designated for were 12 months. And then the average number of births for the hospitals was 1,144 annual births. For the nurses that we interviewed, 8 of them were in labor and delivery roles, and then 14 of them were in kind of mother-baby NICU roles. Next slide. So for the first theme, which was the change required for BFHI was hard. Nurses really described a variety of psychological, practical, and logistical factors that made BFHI implementation hard for them. Those included resistance to the idea of change, which was kind of a psychological factor, logistical challenges in the hospital, monetary barriers, actual kind of physical barriers in the hospital, and then different staffing challenges. Next slide. So an example of a psychological challenge, there's a quote from this nurse, and it says, "And it is a change for the nurses. You know, nurses are very structured and they have their own way of doing things. And when you put a little dent in that, they have to reroute everything." And then an example of a nurse talking about a practical challenge is when one nurse said, "For us in the nursery, they're saying you're going to do your assessments in the room and stuff. We needed to have baby blood pressures. We had to have ways to do oxygen saturations on our babies. So having the equipment that we needed was a big deal." So hopefully, I think for some of the nurses on this call, that might, sound familiar to those quotes. Next slide. So the second theme was that nurses felt empowered taking a leadership role in the adoption of BFHI. So nurses felt like they pushed their facility to adopt BFHI practices, which was an empowering experience for them. Some common experiences were standing up to resistant parties, taking ownership or leadership of the BFHI work, and a sense of pride after baby-friendly designation. So at one point, the interviewer asked, "And what do you think it took to make physicians okay with the process now?" One nurse said, "We just didn't do it." And the second nurse answered, "Yeah, nurses with backbone." Next slide. And then I also want to share with you all this quote that kind of typifies theme 2. So, if people are beginning this designation process, it is almost overwhelming. The big picture of it is overwhelming. For us, we work together real well. We're cohesive. And I think the director is good at delegating and allowing certain ones of us to take on a specific part of it. And that helped our department on it. You cannot do it by yourself. You can't do it with just a couple people. It takes everybody. Well, it takes a bigger group, and it takes people owning a certain part of it, I think. Next slide. So the third theme that we identified through our focus groups was that nurses felt challenged by the unintended consequences of BFHI. So nurses often express concern regarding certain unintended consequences of BFHI implementation, which included some ongoing safety concerns. So nurses, even after baby-friendly was implemented, they still were concerned about risks of infants falling during rooming in. So while moms had them in the room, especially at night. Nurses were also concerned about increased rates of hypoglycemia with reduced formula supplementation, and also emergency situations during initial skin to skin. So there was some concern that, something might go wrong with mom or baby during initial skin to skin, and they weren't sure, how they might handle that. Nurses also expressed a fear of patient dissatisfaction with BFHI practices. So a lot of the time this was around patients feeling frustrated with a change in practice, like rooming in at night. So they were worried that, moms would be mad when they told them that there wasn't a nursery for them to take their baby to at night. And they encouraged them to keep their baby. They also expressed a fear in patient shaming. So nurses they really didn't want to make patients feel bad for the choices that they made. And most commonly, this was around rooming in and breastfeeding. So nurses were worried that if they encouraged moms to room in, or if they were encouraging moms to breastfeed, that moms would feel ashamed if they chose not to do those things. Next slide. So an example, a quote about an ongoing safety concern is, "I don't think the concern of dropping babies is totally gone. I'm still concerned about that, especially if she is on medication." And we heard that kind of a similar quotes from a lot of different nurses about that. A quote that was about fear of patient shaming was, "That's my only critique of it, is I do feel like it's brought a sense of shame to those that maybe have tried to breastfeed in the past and weren't successful, and they just don't think they can do it again." So nurses, they were just really concerned. They didn't want to make their patients feel bad. Next slide. Okay, so theme 4 was the theme that patient education was pivotal to the implementation of BFHI. So nurses really felt that patient education was essential to successful BFHI implementation. And some common beliefs around this theme was that prenatal education prepares patients to receive BFHI care. So a lot of nurses talked about how essential prenatal education was before they even arrived at the hospital. Another belief was that BFHI improves the quality and extent of in-hospital education. So nurses really felt that they were giving better education to their patients once they had implemented baby-friendly practices. And then the last belief was that community members spread information about new BFHI practices. So some of the patient education the nurses talked about was actually occurring through the community. So as the community learned about practices like skin to skin and rooming in, they were sharing it with mothers before they even came into the hospital to give birth. Next slide. So one quote that kind of typifies this theme is, "I feel like with the skin to skin and the education that all the nurses have gotten about the breastfeeding, the patients are in such a better place. I mean, they just get so much more information and education from every different nurse they come in contact with because of Baby Friendly. And they have more people helping them to be successful, and that's just going to make them be more successful. I've seen a huge difference in the patients." Next slide. Okay, so for the final theme, it was that nurses' attitudes changed from negative to positive over the course of adoption. So nurses really described how their initial negative reactions to BFHI shifted to positive feelings after successfully implementing the practices. For example, one nurse said, "A lot of people thought it was like somebody else coming in from outside saying, 'This is how you're going to do things now.' And lots of times people resent things like that. I think it turned out real well, but just the initial, 'I don't know about this. Who are you to tell us what to do? This is the way we've always done it.' But I think it's worked out well." Next slide. And finally, kind of the last quote to kind of talk about these focus groups is just one nurse said, "It wasn't easy, but was it worth it? Absolutely." That kind of typifies the nurse's description about what the baby-friendly process was like. Next slide. So in conclusion, nurses really shared similar experiences and cited common facilitators and barriers to baby-friendly designation. Nurses described the overall process of baby-friendly designation as challenging but worthwhile. In terms of kind of future directions and how to use the results from the study, are that hospitals seeking designation can learn from these experiences to make their journeys easier. And that's my last slide. Next slide, I don't think there is. Fine. Okay, just my question slide. So we'll open things up now for questions from the group, either about the nursing focus group study I just presented on, or if you've thought of another question for North Mississippi Medical Center, you can ask that question now.